Okay.
She's experienced some depression.
Mhm.
Um, she may have some what do you call that thing you said earlier? Girls eating.
Uh,
She's she's got some things going on in her life that's got her depressed, and um, she focuses on some things, or she attaches on to some things, and it seems like they give her they validate her to
Mhm.
some degree. So I don't know if that's because of a underlying low self-esteem issue.
Mhm.
Um, she's good at masking it. She's a strong person,
Mhm.
but um, she needs
No,
an evaluation.
it's a different area.
I don't think she can literally work, hold a job,
Okay.
nor does she believe she can.
What kind of symptoms are you experiencing with depression? Are you having any SI, HI,
what is that? What is?
suicidal ideations,
No,
homicidal
not
ideations?
not none of that. It's
Okay.
just, I guess, I guess kind of like interaction with people, and then I guess their reaction to me,
Mhm.
in the sense of, I guess, whatever they're seeing, I'm not seeing, and which then that's why he's saying like being disabled at work, because I'm like, then I just may be disabled because I know my way of thinking, or it just seems so foreign
Okay.
to this society, I guess, or
Right.
the society or environment that I'm in.
Mhm.
And that's what I guess I'm struggling with, which causes depression, and then me being closed off. And
And she's reclusive,
Mhm.
so
Are you seeing things, hearing
No.
things, anything like that?
no,
Okay.
it's just difficult.
But so you're wanting to get maybe some mental health therapy, and maybe get established like with a therapist?
well, she doesn't have a place to stay. She doesn't have an income,
Mhm.
No vehicle.
no vehicle, no. She's got evicted today.
Mhm.
Just
Hit after hit
I
after
was
hit.
pretty worried about her last week.
Mhm.
Really suicidal.
Mhm.
Just there was no. I was thinking maybe she didn't see any light at the end of that tunnel because all these dark things,
Mhm.
and she's codependent on her mom, and her mom is codependent on her,
Mhm.
and both of them are in the same spot.
Mhm.
Um, I feel she needs to be somewhere where they can assess
Mhm.
where she is and the best way to treat whatever the situation may be.
Mhm.
Not a 1 day deal or a 2 day deal. It's almost like alcoholics.
A behavior thing, inpatient,
Yeah,
just to
they
just make
become
sure.
real good at convincing people that they don't have a problem.
Mhm. Right.
And that she is good at.
Right.
But it makes it very hard to communicate or dialogue with her. A lot of people would say or have said because of where she is mentally, her thought process.
Mhm.
And for
Those
me
are-
to communicate to someone too as well, without, I guess, my behavior just being seen.
and then when she's confronted with
John, please call 3290. John, please call
when
3290.
she's confronted with issues, daily problems you might have, problems that I would have. She's not able to.
I'm manic bipolar, and then I'm like,
She's not able to confront that.
Mhm. Have
She-
you? So you have had someone diagnosed?
yes, I am, and I'm not on medication. So if I do kind of get confronted with something,
Right.
I can kind of see what he's saying, where I'm like, and I kind of go into like
Yeah, she goes
Right.
into a whole
I got it. Whatever the scenario may be.
So getting established definitely back on medications
Yeah.
and things like that. So when's the last time that you saw somebody for medication management or for therapy?
2014 or 5, no,
It was-
Dr. Goodell, 2007, 6, 7, somewhere in there.
Okay.
And that was Dr. Kadali, who, because I have ADHD and it's hereditary, and you know, if you were to spend 15, 20 minutes with her, you would realize she has it too.
Right.
Really hyper. As you can see, she doesn't gain any weight, you know, and, which makes it hard to give her medications to treat that, because any large dosage, her body weight doesn't, so support that. So it's just kind of, and she's almost 40 years old, and if something doesn't change, to put her in a position to be in the mainstream, then nothing's gonna change.
Right.
It'll just get worse.
So normally whenever someone comes here and they're having these types of symptoms, normally we ask, are you having any SIHI, are you having any hallucinations, any, seeing things, anything like that, any command hallucinations. If those things aren't present, most of the time you're not going to meet that criteria for an admission for an inpatient psychiatric facility. Now, a step down would be like ACSU, which is the Adult Crisis Stabilization Unit.
Okay.
Now, that's a few days, but it's at CommuniCare, but they don't work on medication management.
Okay.
So they're not going to give you those medications.
Okay.
So a lot of times what we try to do as far as like getting something established pretty quick is first we set up an appointment for therapy, but with therapy, usually they want you to see a therapist 2 to 3 times before they get you set up with a psychiatrist, just so they're, not prescribing you meds without actually understanding those types of symptoms. So a lot of times what we do is, we bring this information back to our providers. They kind of go over what, if they're able to prescribe something, but we also recommend following up with your PCP as well. Because if your PCP
She
could get
doesn't
you,
have one.
and we can help set you up with one
Okay.
too. So we can do a few things. We can set you up with a therapy appointment. We can set you up with a PCP, so we can at least get you established with medication until you're able to see a psychiatrist. Because a lot of
Okay.
times, your PCP can help you in that realm of medication management until you get established with a psychiatrist.
Okay.
I can let the provider know kind of the symptoms you're experiencing and kind of see if maybe she can, prescribe you anything kind of until we get that set up for you. Now, since it's,
John, you're needed in room 8,
I think
John.
it's after 5,
Yeah.
so normally they're closed.
6:50.
But what we can do is I can set up a therapy appointment. Like they are 24/7.
Okay.
I can call and do that. For PCP, I can have our social worker in the morning,
Okay.
first thing in the morning when they open, call, set up an appointment,
Okay.
and then call you and let you know when that appointment
Okay.
is. What is a phone number that's good for you?
270 370-5215. Yeah.
5215. Okay. And then, where do you live here?
What, Ronnieville?
Yeah, Ronnie.
Ronnieville.
Okay. Where is Ronnieville?
You stay
Where's that
around
close?
here?
I don't live here. I don't know. I know Ronnieville, but I don't know. Is it still in E-Town?
It's 8 miles outside of it.
Okay. Towards Ratcliffe?
You make a left on 220.
Okay. I'm trying to figure out what clinic would be easier. But I can, whenever I call
Radcliffe or
Access.
E-Town, it's in the middle.
Okay.
Okay.
Do you prefer either? Because I can.
Well, he'll be taking me to.
E-Town.
E-Town. Okay. Yeah. And that way, we want it to be most convenient for you whenever we set you up with an appointment. So I can let our social worker know. I'll send her an email first thing in the morning. She can follow up, make
Okay.
a PCP appointment, you know, and get you established with somebody. I
Okay.
think that would be probably the first step.
Okay.
And then, of course, getting you that therapy appointment if that's okay.
Yes, yes, yes.
Now, have you heard of Communicare before?
Yes.
So that's who we partner with.
Okay.
And if you're okay with that, I can make an appointment for Communicare as
Yeah.
well.
Yes.
Okay.
Yes.
All right. Do you have any questions for me?
No, ma'am.
All right. So I'm going to go talk with the provider, let her know. what
Is
we
that a
talked
pamphlet?
about. Yes.
Got
This is
that?
also Lincoln Trail. Because I heard y'all went to Lincoln Trail. But they have outpatient services too.
Okay. Well, can I keep this? Or?
Yes.
Okay.
Yeah,
thank
that's
you.
fine. I wanted to give that to you, and I probably should have at the beginning, but I feel like getting you established with an outpatient
Yeah.
appointment pretty quick is you know, would be important. So, and if you decide, like, I'm going to get you the address, the number, so
Okay.
if for any reason you won't change your mind and you don't want to fall through there, you want to change it, that date and time, you can.
Okay.
Okay? So I'm going to go talk with the provider, and then I'll let her know kind of what we talked about. I'll get those appointments set up. Okay?
Thank you. Thank you.
Thank you.
Michaela, thank you. Sweet girl. So I'm gonna get a therapy session
And then the primary care provider.
Okay, so call me
will
tomorrow.
give you some medicine until the therapist.
Can prescribe something until I get seen. Got you.
So that's good.